Hi, I'm Dr. Erika Grace, and I started Grace Physical Therapy and Pelvic Health. I actually have a background in maternal and child public health and social work, and I went to school at Duke University Medical School to earn my doctorate in physical therapy in order to specialize in women's health physical therapy, also called pelvic floor physical therapy. I decided to open my practice at Chapel Hill Doctors Healthcare Center, which is an integrative healthcare center here in Chapel Hill. I wanted a safe environment and comfortable environment where women could come to talk privately about issues that might be concerning them. I specialize in pelvic floor physical therapy, which is something a lot of people really aren't familiar with, but all of us have a pelvis. And if you have a look at the pelvis, you'll see that in the middle of our bony circle, there is nothing. And what we have there is a group of muscles that we call the pelvic floor, and they support all of our abdominal contents, essentially. When there are problems with these muscles, a number of issues can happen. Sometimes the muscles get weak, and issues related to that would be stress urinary incontinence or involuntary leaking of urine, or something called prolapse, where one of the pelvic organs, such as the bladder, tips out of place from where it's supposed to be in the pelvis. Another category of issues that can happen with the pelvic floor is when these muscles get too tight. When that happens, it can cause pain in the pelvic area, pain with intercourse, and other types of issues. Chronic constipation is something that we treat here, as well as an issue that I call urinary urgency frequency, where someone feels like they have to urinate more frequently than is usual, or gets really strong urges that feel uncontrollable and also sometimes result in leaking of urine. I wind up treating women of all ages. Postnatal is a really common time. We suggest that all women who've had a baby come in for at least a consult with a pelvic floor physical therapist. We also often wind up working with women who are around the time of menopause, slightly before or after, to address issues, hopefully before they start, and prevent some problems down the road. We do specialize in women's health, but we of course treat men as well for pelvic floor issues and other types of orthopedic issues. When I started Grace Physical Therapy and Pelvic Health, I was the only provider, and I was really only treating the pelvic health issues that we've talked about because that's really my passion. I realized that there was a need for women in the community to have access to a range of services though, and we decided to broaden our services and to be a women's specialty clinic, also treating orthopedic issues that affect women and chronic pain issues, such as fibromyalgia, migraine headaches, and other types of pain that is chronic and difficult to treat. We also recently expanded into the Briar Creek area in order to be able to more conveniently serve women who live out in that direction as well. We want everyone to have access to the services that we provide here. In our culture, women are often taught that after having children or as we get older, we have to accept dysfunction or pain in our bodies. But that simply isn't true. Physical therapy can help. If you or anyone you love is experiencing some of the issues we've talked about here today, please know that our team of experienced and compassionate doctors is here to help you.